As already we have discussed about personal liberties in earlier videos, it is point number 7. We hope impatiently the fast, positive, proper action because the matter related to personal liberty, safety for whole humanity, for 130 crore of Indians, their life their life threatening challenge by improper medication or by improper way of violating medico legal aspects of vaccination. The matter is not about any or some people or few families or any limited sect or minor set of people or some nation or few countries, nor it is personal, but it is related for all humanity, risky for human population, their physical, mental, and spiritual health and survivance by corona vaccine had effects and new variants, and it is scientific research that new variants are due to these all vaccines. Point number 8. Face mask prevents some contagious infection partially. Protect direct saliva droplet inhalation or direct transfer of infection by saliva droplets spread in surrounding air or humanity related infection. Saliva droplets spread in surrounding air or humidity related infection during talking or other social interaction by exhaled air of confirmed infected patients or any respiratory infected person. But after such doubts, the mask must be disposed very safely to protect the users and others. Then another new mask needed if the person goes in crowd. None must wear mask when he is in safe distance or alone or cycling or walking alone or running, jogging or in any kind of exercise. If he is doing alone in farm, in ground, so there he does not need mask, or at gym alone or at safe distance from others. Regularly, time to time, mask must be disposed and changed by a new or fresh one, or washed properly or sanitized whenever there is doubt that it has been infected. An infected mask disposed properly as a biohazard article. The infected mask, its humidity or fungal infection in it may push the user in mucormycosis or zygomycosis, which is called black fungus, which is known as black fungus. Unfortunately, more than 19% more than Unfortunately, more than 90% of Indians never afford to follow mask safety measures, its disposal, or have another new for use at any doubt or risk. Nor government would supply it, nor capable to manage it, nor it is possible practically. If ultimately the same person goes over all the day with same infected mask or next day without disposing it, sanitizing it or washing it properly, everywhere he moves freely, not alone he is in risk, but ultimately he would spread it wherever he moves. He very easily make all persons or related persons Whoever came with touch of him, very easily he will give them infection with his contaminated mask. Unfortunately, the persons with whom he meet or pass through them or came with interaction with them or any other persons, he himself and other all persons feel themselves safe only due to putting that mask, due to that mask, but they does not know its infection and its contamination. Not aware about the mask contamination, they all victims does not know that already the mask is infected. That mask is the actual reason for fungal infection with other correlated causes. Point number 8a. If a person alone or is in proper physical distance with others, then he must open his nose for proper natural physically required respiration or good air for oxygen for better health or to survive with normal life, as body requires oxygen for a healthy function of memory, mind and thinking. As the oxygen is life, its lack, its shortage, its improper supply or flow, hypoxemia causes disease, dysfunction, body weakness, low SpO2 in blood, lung disease, alveoli damage, asthma, breathlessness, or any upper or lower respiratory tract pathogenicity, annoyance, mental irritation, angriness, intolerance, which reduce the immunity. The condition causes low hemoglobin, respiratory muscle exhaustion, diaphragmatic function. The diaphragm, which is responsible for normal and natural respiration due to its movement, so diaphragmatic function, its movement disturbs, breathlessness, asthma. Ultimately, at last stage, even if he supplied oxygen in its maximum measure, his lungs alveoli are unable to saturate supplied oxygen into hemoglobin. I notice such many patients shouting to increase the supplied amount of oxygen till its maximum amount. They continue feel breathlessness, restlessness, even they die in the same situation due to less saturated and low blood oxygen level. Unnecessary long covering of nose ultimately reduce oxygen intake. His or her SpO2 would fall down very seriously, then he become more capable to catch any contagious infection, respiratory infection, either corona or it's any variety or COVID-19 or other respiratory infections, even due to hypoxemia. Diaphragm and its movement disturbed, then body fail to receive and saturate artificially supplied oxygen, then patient require due to diaphragm and its movement, even due to hypoxemia, diaphragm and its movement disturbed, then body fail to receive and saturate and utilize artificially supplied oxygen or O2, then patient require ventilator due to diaphragm dysfunction. It is due to side effects of unnecessary long use of mask or prolonged tight covering of nose, even continue compromised oxygen level ultimately push him to sudden death without appearance of any significant cause of death. Cause of death phenomena or may suffer cyanosis, mental confusion, memory loss or other relevant symptoms due to respiratory exhaustion, or diaphragmatic dysfunction. We will discuss the point number 9 in another later coming video.